The Ministry of Health has promised to resolve the water crisis at 3 major wards at the Korle Bu Teaching Hospital. It follows reports that the surgical, orthopedic and accident wards have had no running water for some weeks now, compelling patients to resort to the use of sachet water. Redwan Karim Osman reports.
The Health Ministry, following the report, is said to have called a news conference to brief the media about plans to resolve the challenge.
The minister is talking about creating a direct line from the headworks to the hospital. I think in the long term that will help us a lot because we consume a lot of water. The service strives on water. Without water, you can't provide health care. So we are looking forward to that happening.
Mustafa Salifu, however, said the challenge had been exaggerated.
Daily Graphics reporter came here, that was on Tuesday, and then we said yes, this was what was happening, but we're getting supplies. But the story is saying that even at the surgical block, we don't have water supplies, and they spoke to somebody at the surgical block. So it's been beating our imagination who at the surgical block is saying that there are no reservoirs and we're not supplying the water at the surgical block.
The news team, however, discovered when we visited the surgical ward that the public relations officer was not being exactly accurate with his representation of the situation. The patients confirmed the situation was indeed terrible and lamented how they have had to spend lots of money daily to buy sachet water.
What I would say is water here is a major problem in this hospital, especially the surgical ward. Because the work that they do here is mainly water. Because all the patients here, look, when you look around now, you see that many of them are helpless. They can't even talk. They use tube inside their distance, and always they need what? To be clean. They are hygiene, and then they are having pampers. Every morning you have to move it and then use water to clean them or to wash them. And then this situation we are in. So in fact, it's very horrible.
No cramo, just say me fiadana me baha. And na me baha no. And then 1 month, 2 weeks. So me dwale shower pure water. Am passe me dwale shower no. Enra nko na e ba wa hapo na Yesu akogu bafu na uko hu ye no. Ansa na Yesu akodwale. Am papa ipimba wa ha. Ye top pure water na ye hwe gu bucket mu. Na ye dibe pepa ye ma no ho. Ansa na ye dibe kodwale. Nti say what is say nsuo hu ye de no kure.
Sembaye menya be 1 week ni de bia nya nsuo. E be jo nsuo agi say ye top water ni anu bi ne de bi nsuo ase e dwale. Nya nsuo mfe nwore. Me ko toilet is cry nya nsuo mfe flash. Agi say tete pure water ansa na dia flash. Ansa na ayi ma nti nsuo de ho ye den wa pa.
They appealed to the Ministry of Health to quickly address the problem. Meanwhile, head of Partnerships for Water Aid Ghana, Musa Ibrahim, has blamed the shortage at Korle Bu on poor management by the hospital authorities and suggested ways of dealing with such situations.
There are now a number of technology options that you can use to harvest rain. Look at the past 3 days. Look at the amount of water that is running, away. If we had put in place rainwater harvesting tanks, God knows how much water Korle Bu could have harvested with all the beautiful modern, roofs and all that, and store and reuse. It is sad for your media outlet to be carrying stories of how some units and departments are without water for 3-4 days, when those departments are supposed to be saving lives.